Hello, one and all, and welcome to this episode of our electrifying series of Decoding AI in Healthcare. I'm Hedvi Shah, Healthcare Consultant at MedSynapse, and today we are diving headfirst into one of the most game changing topics in healthcare AI, which is Agentic AI. Agentic AI is not just about automation, it's about AI that thinks, adapts, and takes action to transform patient care, diagnostics, and decision making. And who better to break it all down than today's powerhouse speakers? First up, we have Dr. Avneesh Khare. Dr. Avneesh is a physician turned AI disruptor, a LinkedIn top voice, and a key driver of AI innovation in medicine. He has been featured everywhere, from the G20 consultation to Times Square, shaping the future of AI powered healthcare. So, welcome, Dr. Avneesh, and it's such a pleasure to have you here.
Thank you, Hetu. It's always nice to be on the MedSynapse platform and nice to see you, Dipu.
And guiding this conversation is none other than our fantastic host, Dr. Dipu Patel, a visionary clinician, professor, and tech advocate who is pushing the boundaries of AI in healthcare education and practice. So, welcome back, Dipu.
Thank you so much, Hitvi, and welcome, Avneesh. It's a pleasure to have you here, and I'm looking forward to this conversation.
Yes, and I think the topic is
So,
also very interesting. Yeah.
the topic is super interesting because we're kind of leading the way in terms of this conversation because agentic AI has been deemed the buzzword of 2025. And we're here to kind of give you an introduction to what agentic AI is. I kind of feel that the last few years, AI has become has been at the forefront of all the conversations we've had. It's been the impetus for the launching of this podcast and the entire Doctors AI community. Um, but here we are kind of pivoting again and growing again in the realm of agentic AI. I'll just say that I am very excited about agentic AI and what it is and how it's different from generative AI. So, Avneesh, if we could just start by breaking down for our listeners, what is the difference between generative AI, which is the thing that the AI that we've been using for the last 3 or 4 years, to now agentic AI?
Definitely, Deepu, this is something which is very different to what kind of AI we have been exposed to. So before we understand the difference, let us take a few lines on what is agentic AI. So I would like to break it down. Like just look at the word agentic. That's the first cue. It is some sort of AI that has agency to itself. So it has the ability to act autonomously without or with limited human input. So this is something which is new because if we see generative AI, then it needs a prompting, or you need to open the tool and then put a prompt and then it generates something for you. So it is sort of like a passive kind of AI. But when we are talking about agentic AI, it has the ability to like perceive its environment, initiate actions, take some decisions, gather feedback, then adapt to that feedback, and then go in a goal based like behavior towards its outcome which it has to achieve. Now whether that aligns with values or not, that is a question of ethics which I think we'll be discussing down the line. But then an agent is quite committed to the outcome or the task at hand, and it can do anything to achieve that theoretically. On the other hand, the normal AI, which is not even generative and not agentic, that is something which we use for prediction and classification. So there is three types of AI now. One is the traditional AI, which is for prediction and classification, generative for generating content, but these both are passive. And now we have some sort of a proactively participating AI, which is called agentic AI, which can not just predict, but it can also execute the task. So this is in a nutshell. So, I would like to know more from you. Like, would you like to add to this?
Yeah, no, I agree. I think the three classifications that you've summarized towards the end, the traditional AI, which we is very much solving specific problems using the specific rules that we are training them. It's great for predictive modeling because it requires a lot of labeled data, right? So supervised learning in the context of where we could potentially use it in a healthcare context. Generative AI, which is the Chat GPTs and Gemini and all of those other large language models they're really good for creating new content, but it requires still a lot of human input. It requires us being able to, as humans, directing the generative AI or the large language model to create the content or whatever the output it's going to give us, whether it's text, images. Now we've had some newer things happen this week actually around image generation that it's really ChatGPT is like pulling its hair out right now, but that's for a different conversation. And then that brings us to agentic AI, which is kind of the best of all of those AIs, right? We're really learning to leverage AI for the adaptiveness and I dare I say thinking for us and reasoning for us. I hate to use those terms because I think it makes people nervous that this is the AI that's going to take over the world. I still think we're very far from it, but I do think that it adds an additional layer of executing on actions without the input of human input. It still requires us to be the ultimate arbitrators of what it will output and what decisions it will make. But I think I see agentic AI as goal oriented. We give it a goal and it will go and execute that based in the rules and the context that we are going to give it. So, yeah, I totally agree with you. And I think as we look forward, and you and I were talking about this just offline, um, in healthcare, it's going to take a little time for us to adopt to agentic AI. In fact, we haven't fully adopted to generative AI. So I think it'll take us a little time. And so I would see this conversation that we're having as the beginning of that journey of what agentic AI is going to be able to do by the end of this year and potentially even next year, because we haven't fully vetted this particular modeling in the healthcare world. So I would agree with you, but I think the areas where in healthcare we could use agentic AI is monitoring of patients' vitals, like in the ICU or cardiac care units, and then alerting the clinical team in a more real time without direction or without prompts. Like it will automatically know within the environmental context of what it needs to do. Now we're far from it yet, but I think that's where I would envision it being used. Are there other areas of niche that you see in healthcare potentially for agentic AI?
Yeah, definitely. So, Deepu, what I feel is a very low hanging fruit is some sort of these administrative tasks, which we do on a repetitive basis,
Yes.
like maybe generating some discharge notes for normal routine cases, or for generating pre-authorization reports to send to insurance companies. So, what
Yes.
these AI agents can come and do is, like, the traditional AI just gives us a prediction or a classification, or it just gives us some sort of hint. But agentic AI has that power to execute upon that insight, and then what it does is basically, to break it down further for our audience, is when you give it some
Mhm.
sort of a goal, you might give a larger or a broader goal, but then what agentic AI does, it breaks it into small parts, multi-step parts, and then it sort of, I would say, simulates reasoning. It doesn't reason exactly, but then it simulates kind of reasoning how we do on each step. It takes a feedback and then it adapts. Three keywords: autonomy, adaptability, and goal oriented behavior. So wherever we want these kind of functionalities in medicine, for example, we want, maybe for scheduling patient appointments, we want some sort of an AI agent which can look at the doctor's schedule, it can look at the OPD, OPD footfalls, and then the patient condition. Take all these into consideration and then find the most optimal pathway, or the most optimal next appointment available for that patient, and then book it. So that would be the complete loop that the AI agent has to offer. And I feel personally the administrative area should be the first place where we should try to check out these AI agents, because the stakes are low and there is less ability to cause harm. And then when we improve with these agents, I think we can bring them gradually into this remote patient monitoring and kind of clinical decision support system framework. Because why I say this is because many of the healthcare workflows are quite complex, and we ourselves haven't been able to like tear them down, so as I would say, because if you want to improve something, you have to tear it down and then improve it step by step. We haven't been able to do it in healthcare in many of the clinical areas, and there's a lot of variability from geography, from language perspective. There are a lot of differences in the way we deliver care. I think once we have figured out all those things, then maybe we can build better AI agents which can be context aware, and they can have a better
Yeah,
goal oriented behavior in an autonomous fashion. Autonomy is key, and once you are giving something an autonomy, you should be very much clear that it is not going to ask you every time before executing an action.
that's
So
right.
that is how it is.
Yeah. I mean, it really is bringing to life what we, I guess now 2, 3 years ago, thought generative AI would do, which is be a collaborator with us, and it has been actually with co-collaborating with us. But I think agentic AI actually solidifies that footing in this world of AI and human collaboration, rather than with generative AI, where the human asks the model to provide an answer or provide guidance. Agentic AI works with the human, and sometimes doesn't even need the human for the answer. Consider if we've given it the appropriate goal to execute on things. So it really does um, changes the dynamic of who drives the task. It's not just the human, it can be the AI that can make decisions, take the initiative, make a priority list in which order things should be executed, learn from the environment that it's in, and then execute multiple steps towards whatever the outcome or the goal is going to be. It reminds me of and I'm sure you've seen it, Avneesh, where there's a video circulating on the web about two agents talking to each other, and they're using English to talk to each other. Then they both realize that they're both AI bots or agentic AI, and so then they just start talking in gibberish, right? And they execute the goal without like a human understanding what they are saying. And I think that's kind of where we're headed towards. That is going to really eliminate a lot of the excess task-oriented work and repetitive work that we do in healthcare, but in our general lives as well. Things like, you need to order paper towels or whatever every 3 months or every whatever. You won't have to go into your account to order that every single time. It will keep track of how many paper towels you've used, and it will order them for you. That's just a simple example. But within the healthcare context, there's a lot of nuances that, and you're right, there's complexity in the care we deliver. You and I are both clinicians. A decision you may make, I may not make the exact same decision, right? Follow up for you may be 10 days, for me it may be a week, depending on what we're hearing from the patient. So even just that change, right? 10 days, 7-day follow up or 3-day follow up is enough complexity in the decision making that doesn't quite allow us to fully adopt agentic AI right now, but I think we're going to get there eventually. Probably in the next, I would say, 3 to 5 years. One of the things that I'm very excited about as an educator is how it's going to shift teaching, learning, and education. And so, it one of the things that I see used very often is AI scribes. And I know, Anish, you've talked about some of these models. Are there ones that you can think of that are in action today that really are going to make our lives easier? And I'm thinking of something like Nabla or Nuance in the US, but I'm sure in India there are several as well.
Yes, so I just maybe last week I took a demo of a startup which is like based out of a tier two city in India, and they have sort of developed
Mhm.
similar kind of technology where you just have to speak in your natural language, and the entire note gets generated, and they have incorporated a lot of regional context awareness kind of features, which depending on the
Mhm.
patient demography and geography. So all those things are coming in, even in India. Uh, I think it's called Medimitra AI. So that's the name of the
Okay.
startup. Very promising team. One of them is a doctor, and the other one is a engineer. Both are sisters, and they're working in collaboration, like doctor engineer working together. So that's a great example of teamwork. And I see more and
Yeah.
more of these administrative, repetitive tasks like documentation, generating notes, generating discharge notes while I am taking my rounds. I think all these things can
Mhm.
be handed over to agents in a uh, like in a stepwise fashion. Maybe by running some pilots and
Mhm.
then seeing, because what happens is, as I told you, these agents, they are only concerned about their outcomes. They want to achieve that
Right.
by the most optimal means. But if whether that optimal means matches our values or not, I think even in as human beings, it takes time to understand each other's values. When we converse with each other, when we communicate, it takes sometimes years to understand values. So similarly, these agents need to understand our human values, because there will be moments there not.
Mhm.
So this is another example of how a small technical glitch, or maybe just bad internet, can create such havoc if an agent is operating here. Because I was a human being, so I was able to take some corrective actions, and I could.
There you
Uh,
go.
so I think the example that you give, AI scribes, of course, I agree. Another area which you told, the napkin paper example, that brought to my mind optimization of these supply chains. Uh, there are a lot of supply chains even in the hospital.
Mm.
It's not just about us as persons. There's a lot of stationery coming around in the hospital. There's a lot of medicines coming around. So how to optimize those? Maybe we can develop some agents for those as well. Those are some areas where I'm really excited to see some really effective AI agents which can bring down the cost of healthcare also with time.
Yeah. And I think the other one other example, if I may add, is around clinical trial matching agents, which is looking at eligibility criteria for a particular trial, match patients and sites, and then assist with onboarding. So, and that's, we're not quite there yet, but that's certainly something, that particular area, clinical trials, we have data and label data. So it wouldn't take us very long to make that particular AI agent, because it's so prescriptive, the data is. And so matching sites and patients based on what the goal of the trial is, or the outcome that we're looking for, would really be just a matter of really aligning our own values and making sure that we're not obviously doing any harm to patients as we're doing trials. From an education perspective, we're looking at autonomous tutoring agents, really leveraging the learning for students, so that these agents are not just simply giving out answers. As someone who does use a lot of these large language models to kind of tinker around how to teach and how to leverage them, just saying like the goal is for my student to learn X, these three objectives, go and teach it to them. That really changes the dynamic of the not the burden of teaching, but the task of teaching. Because right now what I want to do is connect with my students on a more human and personal level, and be able to explain things from my own clinical experiences, rather than read from a PowerPoint slide or a book or text. Right, I want to be able to share my stories and my experiences, so that they can learn from those experiences. And then, of course, grading, which is like the bane of every professor's existence. And by that I mean like grading long essays and capstones, and but being able to standardize the grading, so that it's not just subjective, from me grading it to you grading it to a third person, and then getting three different grades. And also a better assessment of longitudinal student learning, right? Saying, I'm starting my degree in XYZ, I'm a freshman or a first year student. my goal is at the end of 4 years, I want to be able to do this, and having that AI follow you longitudinally through your entire learning journey for those 4 years or 6 years, whatever it may be, and support your goals, but also help you with better time management strategies, also monitor well being as you are progressing through those various goals. So there's so much potential that we have. We just have to start figuring out what are our goals, what are the values that we want instilled in these agents, and how do we want to leverage them. It's still early, and I think we as a society, as culture, need to start thinking about what does partnering with agentic AI look like for the values that we want to imbue in these agents. So I couldn't agree with you more, Avneesh, about the healthcare examples. Um, as we move forward, what are the things? What do you think the connection between agentic AI and large language models like GPT? So, we're going to get a little geeky, and I think you know it better than I do, which is the different, like, we it's leveraging a lot of the foundations of generative AI, natural language processing, these large language model interface and reasoning engines. But if you could just get a little bit technical about what we're leveraging from generative AI to agentic AI.
Yes. So, see, we have always, as humans, we have used natural language to communicate, and that is what we have reflected down in the large language models. The example that you gave of two agents talking to each other in gibberish, of course, that's scary, but I think that's the future, because maybe the human language is not the most efficient way to talk from one machine to another machine. But I think
Right.
that's a topic which we'll come to know, like what happens down the line. But till that comes, I think large language models provide, as you said, a base of language skills to any AI agent. So
Yeah.
it helps in understanding the natural language and in generating natural language, because many of these AI agents are supposed to interact with humans, right? We are talking about human machine interaction. So that is where the LLM component comes in. And then agentic AI goes one step ahead, and it adds the autonomy and the decision layers which we were talking about, like the planning frameworks, feedback loops, reinforcement learning. All those things are built as an agentic AI layer on top of this LLM. So if you want to see an example, so that, like, LLMs are the voice, and agentic AI is like the brain and the limbs. So LLMs will only fulfill the voice function, but then you need sort of that agentic AI layer to be able to execute tasks depending on the environment and depending on your goal, goal and the context awareness which you build as you work in that environment. So that complete thing, LLM plus that agentic AI layer, is equal to an AI agent. That is, if you want to understand it in the most simple terms. I would like you to add to this, like, this is what I understood.
I love the example. I love the example that you gave, right? The generative AI is the, I guess,
Voice.
the not the brain, but like the body, and then
Yeah,
the agentic AI is the arms and legs. Oh, the voice you said, the voice you said. I love that. I think that's a great example. And so an example that I would think of, that a low hanging fruit example of the implementation of agentic AI in healthcare is using GPT for natural language, meaning I'm capturing information as I'm interviewing a patient using ambient listening. But then, as it's documenting what I'm taking from a history and physical exam, agentic AI is coming in and saying, okay, I've pulled the data based on what you're telling me. Here are the last labs. They're due for, a CBC, or they're due for their iron workup, or they're due for their colonoscopy or their mammogram. And based on what I'm seeing. And I'm also going to go ahead and schedule XYZ appointments for the blood draws and the colonoscopy and the mammogram, because I can see that the patient's calendar has these openings. And it's more important that we get the mammogram done sooner rather than later. The colonoscopy can wait 3 months. Like, all of these kind of decisions that the patient physicians make, which are not necessarily, sometimes they're really important in terms of timing, but sometimes they're not. And all of this is interfaced with the EMR, the patient's calendar, and as well as all the other calendars in the various departments. So that's the additional layer that we're looking at. The efficiency that's going to be put into care delivery, and you're right. Hopefully, cost mitigation as
So
we
if
move
I can,
move forward, and we'll be able to kind of yeah. Go
yeah,
ahead.
if I can add an example from my my clinical history, so to say, like I'm an ICU professional.
Yeah.
So in ICU we put a lot of central lines and we
Yeah.
do a lot of procedures, and every procedure has sort of a care bundle. Like if you are putting a central line, you have to put a central line care bundle, which includes measures for infection control and to prevent central line associated infections. And many of the times we used to forget
Mhm.
putting that order into the system. So why not an AI agent? Like you gave an example of that lab test thing. So similarly, once I put a central line, I think all these orders should be put like they can be done by an AI agent, right? So this is something
Automatically.
which is sort of
Yeah.
low
Yeah.
hanging fruit. Why we should depend on human cognition for this sort of uh, not I would not say not very important. I think in fact it's the most important task to reduce ICU mortality. But then it doesn't need a human cognition to do that, to just put that order. I think that AI agent can be easily told to do that if we program it well and if we give it the correct sort of that base of working upon, and even it improves with time, so it learns like which patient needs which care bundle. So I think that is always a learning process. That was one example which came to my mind, so I interrupted you. So I'm sorry, you can continue. You were saying
No,
something.
no, not at all. No, and I think that's an excellent example because you're right. It's not that it's not important. It's that as a human being, if we're taking care of a patient who's really critical in the ICU, putting in that extra order is the last thing that's on our mind, right? Our mind is really on taking care of the patient. So that's really important of kind of lowering the burden of these automated tasks that should happen, not the clinical decision making necessarily, but the task that's associated with it. Well, so in that context, as we are differentiating between task and clinical decision making, I mean, you alluded to this in the first part of your, and the earlier on in our talk, which is about the ethics of this, ethics of AI in general, but then specifically as we look at agentic AI, where they're becoming autonomous and they're, we're saying this is the goal, go do it. How do you foresee the balance of using agentic AI in healthcare? I know we're kind of far from it. I don't think it's going to happen anytime soon, but these are conversations that we should be having as a community so that we are making sure that that human in the loop component remains very strongly rooted in the care that we deliver. So what are some thoughts that you have around that?
So I completely agree with you, Dipu, that ethics is going to be at the center of this conversation, especially with agentic AI, because it is giving out agency is not something which is small thing. It's a very big thing, and how much agency to give, uh, and where to give. All these questions are going to come up. But the most important thing, as I already mentioned before, is the value alignment. Uh, as a human being, whether I'm going to make the same decision if I'm placed in the same environment with same outcomes. As you said, sometimes you might call a patient after 7 days. I might call after 10 days. It all depends on uh, like how we take a decision in that situation. Every time we don't take an optimal decision,
Mhm.
which is optimal
Right.
scientifically. It might be optimal culturally. So we have to build that kind of value system in these AI agents. I think that is going to be the biggest ethical issue. Of course, other ethical issues, as always, associated with AI, like bias. So if I'm allowing the agent to make a
Yeah.
decision, I'm not keeping a check on it. So it might make a biased decision, and then I might come to know about it very late, at a point where I can do nothing.
Right.
Third thing, very important, is going to be accountability.
Right.
And with this agentic AI, this
Yes.
debate is going to get more fuel to the fire. I think. Who is accountable? Is it the AI agent who booked the appointment, or maybe didn't book the appointment? So we have to answer these questions. Finally, cybersecurity. Just imagine if someone hacks your AI agent and just directs it in some in a manner, or just inject some sort of a thing. I was reading a blog, I think someone from Microsoft, she wrote very beautifully. She compared it with the movie
Mhm.
Inception. So in Inception, what they do is they go into the dream sequence of a person, and then they implant or plant some ideas. So agentic AI is going
Memories.
to be
Yes.
something similar. And we are going to be those inception agents who go and put those inception ideas into that agent, and then when the agent wakes up, or it is called upon to do something, it acts upon those ideas which we have planted. So if a bad actor is there,
Yeah.
they can do complete value misalignment, and I think we need to safeguard. We need to build safeguards also. So these are some ethical issues which come to my mind when I talk about AI agents specifically. What do you feel?
Yeah. And I would agree. And to just to build Yeah, build upon that. I think one of the questions that I have, and this is more philosophical, I would say, is that is agentic AI truly understanding context and nuance, or are we just getting better at simulating that, right? And because currently AI doesn't understand human sense, it doesn't have a conscience, it doesn't have emotions, or true situational awareness, right? When we make life or death decisions like in the ER where I worked, or you in the ICU, it can give us all the data, right? Like here is the data to make all these decisions, but ultimately it's the human component of the emotion and the consciousness that we have as humans that truly makes us human. And so while I think all of these agents are fantastic at analyzing patterns and understanding data sets, they can even now adapt tone and content. Much like we still can't read tone in an email, I don't think we're quite there to allowing just an agentic agent to make decisions, because it you read it, or it said it. So I think for me, it's important to keep in mind that these agents don't actually feel empathy. They are not feeling, and I think sometimes we get lost in the simulation, so to speak, to your point about the inception of like getting into the dream world and we live in there, and then it's like, oh no, that can't happen quite yet. So I do think that we're going to continue to have conversations around what is true reasoning, what is nuance, what is context, and what does that mean. Ultimately, I think us as humans are going to have to really put these strong guardrails around these agents so that we don't have, I mean, we'll always have bad actors, but I think that we keep things like patient safety and patient data, and HIPAA really at the forefront of all the decisions making. And so the key right now, I would say for everyone, is not mistaking simulation for cognition, because that's not where we're at yet. These are powerful assistants that can help you make decisions, and they can collaborate with you, but they're not actually thinking and they're not actually feeling. That's our job as human beings.
Yeah. So how I like to
So
explain to my
that's kind of where
Yeah. So how I like to explain to my students in a single line is that Chat GPT telling you that it's thinking doesn't mean it's thinking. It's just typing
right.
that thinking word in, and
It's
it's
thinking.
just doing pattern analysis in the background. It's all about data. Basically, it's data, and we humans
All
have
about data.
something which is much more than data built into our nervous system. During this evolution, we act a lot on reflexes. We have a lot of good biases also. So I think it's a long way. We are still far away from AI agents uh, being able to think or reason in true sense.
Yes. And I will say, I think part of it is, this actually shows human fallibility a little bit, because we're using words that are very human to something that is not human, right? And so we may need to come up with completely different vocabulary and completely different terms, because me thinking, you thinking is not the same as a large language model thinking or an agent thinking. It's not the same, right? It's as you said, pattern recognition. It's not actually thinking, and so we will need to come up with different terminology. Completely. Same thing with hallucinations. There's been conversations in our community that hallucinations are very much it's a human term, right? It's applicable to human beings and aberrancy of human pathology sometimes when it comes to hallucinations. But that's not exactly what the model is doing. It's not. And so this brings us to an entire other conversation about how terminology is going to shift from human to computer. We're going to have to, we're running out of words in our in our language, and maybe we can ask the agentic AI to come up with terms that are distinguished from human to AI.
Good idea.
Well, I'll kind of lead with the last question, which is I think you touched upon, which is global implications of agentic AI, especially for low resourced settings. And part of that understanding data sets, right? Like all of the work in this space, all of the building that's happening around agentic AI is dependent on the quality of the data that we have, the quality of the data set, which then brings up the issues around equity, right? We don't have enough data for all of the areas that we would like to, especially the low resource and the rural areas that we aim to actually close healthcare gaps in. So, as we look forward, what are some of your thoughts about how to really leverage AI in general, but specifically agentic AI in these low resourced, low data environments, that so that we can kind of level the playing field for all.
Yeah, Dipu. So this is very something very interesting about AI or with technology in general. While agentic AI has a potential to bridge those gaps and improve the access in healthcare delivery in areas where there's workforce shortage or in low resource settings, at the same time, it has a potential of creating uneven access and digital divide, and even sometimes technological dependence or automation bias among the users of especially agentic AI. So I think that there are two sides of the coin. It's not either all good for low resource settings, and it's not all bad for low resource settings. We need to find a we need to like walk on that very fine line of balance where we give equitable deployment, and then also we have that equitable training among the
Mhm.
users, and something as simple as internet access, a good quality internet access in those areas. I think so. In a single line, agentic AI, I think, has the power to democratize access to healthcare, but only if that access is fair. Means there's a conditions,
Fair.
a star button to it, and that applies to agentic AI
Okay.
also. I think those are my
So I couldn't agree with you more, actually. And we're going to wrap it up now, but we have one question from our audience that I think both of us can kind of tackle. And that is, what is the most promising application of agentic AI in personalized medicine? So I'll start it off with you and then I'll wrap it up.
Yeah. So one of the examples you already, I think, Deepu, you mentioned when we were talking that it's about like uh, remote patient monitoring, right? So whenever a patient is having data coming in 24/7 from sensors, and then what agentic AI can do is it can not just predict events or analyze that data, but it can then take certain actions also on that. So if that patient needs a particular
Right.
intervention, another patient with similar characteristics might not need that. So that agentic AI can act upon that uh, insight, and it can help actually deliver personalized medicine, maybe alert the medical professional in time for that particular patient. Second area is post surgical. I think there are two good companies working in this area. One of them is
Mm,
Hippocratic AI, and one is Quadrivia. I think they have multiple agents which can be personalized to patients post procedures like endoscopy or post minor surgeries, where the agent takes regular follow-ups from the patient, and then it reminds for the medications, and then it also books follow-up appointments depending on the patient's condition. So it's all personalized. This is not like some sort of a standard algorithm which we follow
right.
for all the patients, one size fits all. So these two examples come to my mind immediately when we talk about personalized medicine in terms of agentic AI. Yeah, that's it.
Yeah. I will add one more example, and I think that's around medication compliance and really understanding how a patient is not only just complying with medication, making sure that they're taking it, but then also getting a deeper understanding of side effect management of a particular medications. The setting that comes to mind for me is oncology because we tend to give regimens that are multiple medications and tend to have a lot of adverse effects. This would be a great way to mitigate and manage a lot of the adverse effects for these very potentially sick patient population. So I'm going to wrap it up with a quick thought around exactly Avneesh, agentic pharmacovigilance. Exactly. I'm going to wrap it up with a quote that I've kind of started to really understand and hope in a philosophical manner, which is agency gives AI the power to act, values give it direction, and those values have to come from us as human beings. And so I think as we move forward into this era of agentic AI, remember that as much as these agents have the agency to act, we are the ones who are shaping the values that we're going to give it, that is going to give it direction to execute on the goals and the tasks that we want them to. So, on that note, thank you, Avneesh, for joining us for this month's episode of Decoding AI with HealthCare. To our audience, thank you for joining us. We hope you found this episode informative. This will not be the last time you hear about agentic AI. It is here to stay, and I think it's going to grow. Look for more information on agentic AI, both on my LinkedIn as well as Avnish's LinkedIn post. And please follow us at the Doctors AI community. And if you haven't signed up for our newsletter, please go ahead and do so. Thank you very much and have a good afternoon, good morning, and good evening.
Thank you, Dipu. I really enjoyed the conversation and learned a lot. Thank you.